Greg Fischer. So we're going to take a rundown of what the latest and greatest here as we continue to fight the dastardly virus here in our community that's certainly wreaking havoc around the country, and all of our citizens are working together to make sure we deny the virus. I want to start just by saying thanks to everybody that's really been doing a good job with social distancing, wearing the mask out in public. We know the ways to beat the virus, and fortunately, the vast majority of our community is really complying. And that's how we get to the back to whatever the new normal is going to be, is by all of us doing our part. So I want to say thank you to everybody. I recognize this is a very difficult and a lot of change on our lives, but we didn't ask for it, but we got to deal with it right now. So let's move through these disruptions the best they can. So thank you, everybody. Let's stay positive while we keep making progress. Let me talk now about the numbers. That's where I start every day with. Cases continue to rise as we expect them to be, as more and more people are being tested. We now have 402 confirmed COVID-19 cases in Louisville. That's an increase of 30 over yesterday. And at the same time, we know there's a lot more cases than this. We have 402 tests, but there's probably another zero or even maybe two zeros after that, because we just don't have enough tests. And a lot of people have no symptoms that are walking around with the virus. So 402 confirmed. Now, since yesterday, I'm sorry to report that we have lost 4 additional people to the virus. That brings us to 27 so far during this pandemic here in our great city. And unfortunately, we know that by looking around the world and the country, there's going to be more. And it's very sad to always report these numbers and think about the families that have been impacted by this, and how the people that are passing oftentimes are passing without any of their loved ones around them, especially if they're in the hospital. So please do everything you can to make sure you are not spreading the virus, out of respect for yourself, your family, and certainly in memory of these folks that we're losing every day. Some other data we have about our first responders. I want to give a big shout out to all of our first responders. They are still doing their job. They're as difficult enough as it is, much less while they're in the midst of fighting this virus here in the community. So the total number of our first responders we have off today due to COVID-19 is 38, and 6 are in self-isolation after positive tests. That includes 3 from LMPD, 1 corrections officer, and 2 from the sheriff's office. 23 are off and quarantined due to exposure to someone with a positive test, and 11 are off either with symptoms or they've been tested but have not yet received the results. And the total number of positive tests for our first responders since the start of this health crisis is 9. And happily, we have 3 first responders who once tested positive but have recovered and returned to work. So most people, when they get the virus, are going to recover. They can have mild symptoms, severe symptoms, but most everybody comes out of this. Also, in our jail, 31 inmates have been tested. Of those, 26 tests were negative, and we have 5 pending tests. Now, when we look at the national and global picture, we're starting to see some positive signs, though there's obviously lots of reasons for tremendous concern. And the minute any of us let our guard down, any of these positive trends could stop. And these positive trends are intermeshed with some tragedy. So in New York, Governor Cuomo is indicating that they may be reaching a turning point in their COVID crisis as the number of hospitalizations has started to stabilize. But at the same time, New York recorded the most deaths that they've had in a single day. So you say on one hand, it looks like maybe it's leveling and going down, but then the wave of folks that have the virus and may not make it, you're starting to see that number go up until the supply that's going into that number of people being infected goes down. So it's kind of conflicting when you think about that. Where this virus all started was in Wuhan, China, and they are lifting their lockdown restrictions on their city today. But they're a long way to normal. The headline said, they returned to a city that has been dramatically altered because of COVID-19. And we too have to remember, just as our national leaders have said us, we've got to really prepare ourselves for a lot of tough news this week and next week. As of a couple of days ago, we had lost 10,000 Americans already. And to understand kind of the exponentiality, the rapid spread of the virus, consider this. The first 5,000 deaths in America, it took 1 month for them to take place. The second 5,000 deaths happened in just 5 days. So think about the scale of how that's going up, and as different big cities in particular are reaching their peak right now. And we're now around 12,000 deaths in this country. So we each have a job to do, right? And that is to deny the virus. While one death is too many in our city, you can see compared to the big numbers that we're doing relatively well. I'm thankful for that. And that is not to diminish any one of these folks that we have lost to this virus. But we are not seeing the kind of overwhelming numbers that they're seeing in other cities right now. But we also know this could change at any time when we let our guard down. So let's keep at it. I really want to say that our hospitals are doing a great job. Hospitals, our healthcare warriors. Imagine if that was your job and you got all these COVID positive people coming to you. You got to obviously be concerned about your health. That's why we got to make sure they got all the PPE, personal protective equipment gear that we can give them. But we're working with them each and every day. Our hospitals are adapting very quickly. We're seeing the development of COVID specific teams. They're separating their hospitals for COVID patients and non-COVID patients. So the collaboration and innovation in our hospitals has just been very, very impressive. So to U of L, to Baptist, to Norton, thank you all. Doing a great job here and leading us through this epidemic. And, most wars you see soldiers in uniform that we're used to seeing. Now we're seeing soldiers in scrubs, and we're seeing soldiers in the janitorial unit. So anybody that works in our healthcare system, keep up the good work. Thank you. So we're going to continue to honor folks too. When you've seen the color green, the Big Four Bridge, Metro Hall, City Hall lit up in green. Green is the color of compassion. We're the International Model City of Compassion. So would encourage anybody that has some green to show or some lights to do that, just to let people know that we are all in this together. And people, when you think about we're in all this together, we're interdependent, right? You can think about that from a human standpoint. You can also think about that from a faith standpoint. And this is an extraordinarily significant week for the faith community in America. Passover begins tomorrow, and this is Holy Week in the Christian tradition. So Friday is Good Friday, followed by Holy Saturday and Easter Sunday. And this is an incredibly special time in our community when so many families have traditions for going to church together, getting together after that, having their seders together. But this year it's going to be tough to do that. So I want to talk about that a little bit. Yesterday, Governor Beshear, who's just doing a great job for our entire Commonwealth, said that he approved for Kentucky communities, cities, and counties to make their own decisions about conducting drive-through services for this weekend based on their local conditions. So in Louisville, and this is with a heavy heart. I do not like to communicate this because it's sad that we are not able to allow these drive-in church services that you're reading about in some other areas. So I am reluctant to do that, but at the same time, I am emphatic in doing that because I want to save the lives of people in our community. And some people say, well, they're doing it out in the state. Why can't we do this? Well, because we're in a very different spot than the rest of the state. I want to really say thank you to the governor for his full-throated support of our decision here in Jefferson County. Hopkinsville is also not allowing this to take place because they've seen significant spread in that part of the state, and that started at a large religious gathering out there. So why do we have to do this? Louisville's an urban environment, so it's not really practical or safe to accommodate drive-up services taking place in our community. I mean, think about this. On Sunday morning, there would be hundreds of thousands of people driving around our community. Our population density is 17 times greater than Kentucky as a whole. So this is not the time to put large numbers of people in the same space. That would just create a tinderbox for the virus and creates way too many opportunities for people to contract the disease. And so that's sad, and I don't like it. But remember, our job right now, we've done a good job so far, so we can't let our guard down. So no drive-through church services allowed in Jefferson County these coming days until further notice. So again, I'm sorry about that. And when you think about the family gatherings that we might have, uh, this prohibition absolutely applies to traditional family gatherings as well. If you're bringing new people, even if they're in your family, into like your traditional bubble of your own family, you're introducing the risk of passing the virus. So I really know the pain that this brings. I've not been with my mom and dad now for probably 3, 4 weeks or so. Uh, we have traditions every Easter Sunday to get together, but we're going to have to do it another way this year. So I don't like saying this, but please, we need everybody to comply and understand this is the biggest gift of life you can give. And this is a big sacrifice for people of faith and people who have celebrated Passover and Easter together for generations and generations. So we just really ask you to think about what's most important, and that's protecting ourselves. Because the bottom line is this coronavirus does not care about traditions. It doesn't care about faith. It doesn't care why people are getting together. It just wants to infect as many people as possible. And gatherings, whether it's a Saturday night house party or a Passover dinner or an Easter brunch, the virus loves that. And it gives the virus more opportunities to spread. And our job is to deny the virus. If we don't do that, it means more lives will be lost, as we're tragically seeing already throughout the country and the community. So I know it's tough, especially, well, it's tough in so many ways. But if you got little kids, they're looking forward to their Easter egg hunt or to get chocolates from the Easter bunny. If they're visiting your family, just can't allow that to happen. Okay, that's got to be our way to say we love our family. I don't want the kids to infect their grandparents or their great grands, and that's what we see happening. So let's be smart, because I can't think really of a more painful irony than good people dying because they contracted a virus from a loved one of theirs over a day of Easter to celebrate life and rebirth. So as painful as all that is, we got to hang in there, okay? So that's why I'm imploring people to keep the faith in the work that we've done as a community over these last few weeks with our social distancing. Value of staying home is really worked out. So stay home, worship at home, do it virtually, save lives, please, okay? And the purpose of all that is so as soon as possible, we can get back to doing what we did before. And we can't make an exception even for a holy occasion like Passover or Easter, because the virus, it doesn't take a day off. Okay, so please hang in there with us. And again, I'm sorry, but that's what we got to do to keep each other safe. Our chief for community building, Reverend Vincent James, is a great faith leader in our community. He's going to share a message with us now. Vincent James.
Thank you, Mayor. This is definitely some challenging times that we have in our country and our world. And what we're seeing as it relates to COVID-19 coronavirus, it has been challenging on everyone. And in particular, as we think about the faith community and all the traditions that we have during this time of the year. And so as we think about what's happening and what's going on, it's really critical as faith leaders. Not only do we have the responsibility to care for our congregants, but we also have the responsibility of ensuring their care and health and welfare. That's one of the reasons why I think Mayor Fischer, for his leadership and boldness to be able to take this position, to be able to save our community and save lives. We want to have a church after this is over to go back to. And we want to be able to count everyone that was there before the COVID-19, that they'll be there after COVID-19. In order to do that, we have to practice this social distancing. Through the Office of Safe and Healthy Neighborhoods, one of the agencies that reports to me, we have a Clergy Connect call every week at 1 o'clock every Thursday to reach out to all the faith leaders across the city to have conversations, to be able to connect with faith leaders, sharing information, sharing resources in terms of what people have access to in the city, and also hearing from our faith leaders in terms of what are their concerns and what some of their challenges are. So we as a community can walk together The only way that we're going to be able to do this is that we have to walk together. And we are encouraging everyone this weekend. I know there's a lot of drive-through worship services and ideas around that, really creative ideas. But it is safe to be able to stay apart as opposed to connecting together physically. One of the things that Dr. Moyer often shares, she talks about the fact that it's important that we connect, and we connect through social media and other mediums, but it's important that we practice social distancing that's 6 feet apart. And so if you're interested and you're a faith leader in our community and you're interested in joining the call, we'll be posting that on the website. The telephone number that you can connect to is 502-215-8399. And again, I just want to encourage faith leaders in terms of listen to what we're sharing with you. This is a very deadly disease, and we're seeing people die daily. We are in the life-saving business. So thank you so much for the opportunity.
Thank you, Vincent, for that message and all the good work you do at Elam Baptist Church. And I'm reading that some of the houses of worship are having more people attend their services now virtually than they do in person. So this is a moment, I think, where people are turning to their faith traditions.
Absolutely. Absolutely. I think, when you have a time of crisis across the globe, not just in this country or city, but across the globe, that people turn to their faith because they realize that that's what's holding them together.
Okay. Well, so we can be encouraging times. And tomorrow at 10 o'clock on my Facebook town hall, we're going to have leaders from various various faith traditions with us to talk about this Holy Week or Passover. So we'll have Archbishop Kurtz with us, amongst other leaders in our community. So that'll be our Facebook town hall tomorrow at 10 if you'd like to join us. At the center of any faith tradition is this value of compassion. And this crisis has really challenged us as a community, but it's also, I think, revealed like the tremendous compassion and kindness that lives in the heart of our city in so many ways. We saw that, we continue to see it in the response to the One Louisville COVID-19 Fund, which has already raised $8 million and distributed over more than $2 million to social service organizations and individuals that have been impacted by COVID-19. I took a call a couple hours ago from Dorian Burton from the Keenan Charitable Trust, who announced they're donating $150,000. That's new money to our One Louisville Fund. So thank you to the Keenan family. There's great work being done by the Muslim Americans for Compassion, the Vietnamese community of Louisville, and so many others that have been working to provide meals for our first responders and the folks in our healthcare community as well. And then JCPS has distributed almost 300,000 meals to our children in the community since this crisis has begun. And I want to give a special shout out to JCPS because today was the first day where non-traditional instruction started, a lot of online learning taking place. So I want to thank our teachers and our students for adapting to that new environment. But I also want to give a special thank you today to Chef Edward Lee and his business partner, Lindsay Opsasik, and the entire team at 610 Magnolia for a really incredible effort they've put together to support displaced restaurant workers. And they were there right at the beginning of this saying, we've got to keep our people fed. We all know the restaurant industry has been hit especially hard by COVID-19, with restaurants either shutting down or limiting themselves to carry out and delivery. And that has really created hardship for thousands and thousands of restaurant workers. And right away, Lindsay and Ed got together with help from Maker's Mark, Go Bourbonism, and launched the Restaurant Workers Relief Program. And through the Lee Initiative, they provided meals and other supplies to help displaced restaurant workers. Started here in Louisville, then expanded to Ed's Restaurant in Washington, D.C., and now it's grown to 15 cities around the country. So just more great leadership coming out of Louisville from Ed Lee and Lindsay Opsasik. Lindsay is the general manager at 610 Magnolia and the Lee Initiative managing director. She's joining us now. Lindsay, thanks so much for joining us. It looks like straight from the kitchen.
Yeah, thanks for having us. So we're getting ready for tonight's service.
What's on the menu tonight?
We have curried shrimp and coconut rice.
And it'll be the best curried shrimp and coconut rice that anybody's going to eat in the entire country. You guys are known is one of the premier restaurants in the entire country. So we appreciate the work that you and Ed do every day. So tell us a little bit about, I mean, how the Lee Initiative came together and what it's up to right now.
Yeah. So as most people know, our founding program was actually a Women Chefs Initiative to help women rise into leadership. But one of our principles has always been to be able to quickly react to any problem that arises in our industry. And 3 weeks ago, that quickly became feeding our family, our restaurant community, and all of the people that we work with. So the morning after our restaurant closed, we quickly pivoted and became a relief center. We have always been partnered with Maker's Mark, and the great thing about them is not only do they partner with us financially, but they're boots on the ground. So we opened our relief center the first day. Over 250 people showed up. Makers was a part of that, and we all sat down and realized this was not a Kentucky problem. This was a problem happening all over the country. So fast forward really quickly, we have 15 relief centers up and running across the country now.
Wow. So what cities are you in?
So we're in Boston, we're in DC, we're in New York City. We actually have 2 locations in Brooklyn. We're in Houston, we are in New Orleans, we are in Atlanta, Oakland, LA, New Orleans, Houston, and hopefully Cleveland tomorrow. So
That's great.
Here in Kentucky, we're in Lexington, and then we're also in Cincinnati.
Well, great job on that. And what kind of reaction do you get from folks that are coming by the restaurant?
You know, it's an emotional thing. A lot of these folks and our friends are accepting aid for the first time, but it's also a happy time. Restaurant employees and workers are social by nature. We can't necessarily talk to one another, but there are smiles and waves, and we're all just hanging in there the best that we can.
Well, bourbonism, we call it, right? Bourbon and local food tourism, our restaurant industry, our local food, our farmers are the ones that make this magic happen, and it just gives such a special element to our city that no other city in the world has. And, I look at you guys as the kind of the soul of our city with just providing hospitality, and you've done an incredible job over the years. So for all of Louisville, support the Lee Initiative, support your restaurants, whether it's takeouts, right, or carry out right now. You probably say, well, I normally don't tip as much when I do that. Well, tip 3 times as much, okay? Because we got to get that money back into the restaurant and to the restaurant workers who really have been disproportionately impacted during this crisis. So, Lindsay, if people want to donate to the Lee Initiative, how do they do that?
So you can go to leeinitiative.org. You'll see a drop-down menu, and you can choose the city that you would like to support.
Okay. Well, thank you, Lindsay, to you and Ed and the entire team. You guys are amazing just in normal hospitality times, and you're just showing that you're getting it done right now. So great job. We really appreciate you all.
Thank you.
Communication is so important during this crisis to make sure that everybody gets the message. And you might say, well, hasn't everybody heard about it right now? For the most part, yes, but still everybody's not doing the right thing in terms of social distancing, hand washing, wearing face masks as well. So I want to provide another example of people and organizations coming together to beat COVID-19 in our community. And that's through our messaging campaign called Better Together by Staying Apart. So Better Together by Staying Apart. This is a collaboration with Passport Health Plan, the University of Louisville, and U of L Health. I want to say thank you to them very much. And the goal is to just keep spreading the word about the importance of social distancing. So you can see some of the signage work that's being done right there around the community by Outfront Media. They've offered some electronic billboard space for this graphic campaign in places like the Kentucky International Convention Center that you're seeing here and along I-65. We've got other partners like Louisville City FC is using their great new billboard at their stadium over the expressway. The Kentucky Center for the Arts, Kentucky Exposition Center, and U of L are running the graphics too. And so we got more and more people helping out with their space. So if you have that, please let us know so we can utilize your generosity. And then you're going to start seeing additional graphics on TARC shelters and buses, and of course, social media. And the campaign is using the hashtag Better Together by Staying Apart. So push that out as well. and the posters and social media graphics are available for download and share. And so we encourage everybody to remind people we are better together by staying apart. And the goal is to make sure that everybody hears and keeps hearing, but more importantly, living by the key messages we've shared about social distancing. So we ask our friends in the media and everybody really to help us share this message, save lives in the process. Okay. So again, I want to say thank you to Passport Health Plan, the University of Louisville, and U of L Health and Outfront Media, who are helping us show the world that, in fact, we really are better together by staying apart. Well, that's the consistent message from our health department as well. So it's time for our daily public health update. And today we're joined by our great medical director, and that is Dr. Lori Kaloya, who is helping lead us through this crisis. So, Dr. Kaloya, what's new today?
Thanks, Mayor Fisher. Today I wanted to touch again on the CDC's new recommendation encouraging the general public to wear cloth-based coverings when going out once a week for essential needs like food and medicine. I've been seeing more and more of these in the community, so I think it's important to emphasize some points about these coverings. Why is the CDC now saying that it's a good idea for people to wear cloth-based coverings? It's important because we've learned that many people with COVID-19 may be infectious before they begin to show symptoms, and that many people who carry COVID-19 infection may not show any symptoms at all. Because of this, the CDC just recently began recommending wearing a face cloth when going out to places like grocery stores or pharmacies once a week when you get your necessities. It's not always easy to stick to that strict 6-foot social distancing in some of these places. I know businesses and individuals are doing the best they can, but sometimes it's not that simple. So we also know that the novel coronavirus can be spread through saliva and nasal secretions produced by coughs, sneezes, singing, or even just talking. So the face cloth can reduce the risk of someone becoming infected with COVID-19 and unknowingly spreading that infection through those droplets in which the virus tend to pitch arrive. So if you decide you want to wear a face cloth face covering, the next time you go out, you should keep in mind a few things about the face covering. One, make sure that it fits snugly but comfortably against the sides of your face. If it's flapping around, it's not going to do very much good. It needs to be secured, so either ties or ear loops. And I know there's some examples of these on the Centers for Disease Control or CDC website. I'll give that one here in a second, but it will show what that actually looks like. The other thing is it needs to include multiple layers of tight weave or tightly knit fabric as well. And then certainly you need to be able to breathe with it on, so there has to be at least some ability to breathe without restriction. You shouldn't feel like you're suffocating in that mask. And then the cloth, the purpose of the cloth is so that it can be laundered, because when you get back home from being out doing that essential needs shopping, you want to be sure that you can wash it right away. So the other important thing is make sure, even though you're wearing a mask, you don't want to let that give you false reassurance. Make sure you're still not touching your face or the mask while you're wearing it. And then the other thing is little kids are not very good at being able to protect their own airways and their own breathing. So you don't want to put them on children under 2 years of age or anyone who has difficulty breathing. Certainly no one that's unconscious or incapacitated or otherwise has difficulty removing the covering without assistance. When you get home from being out and about, like I mentioned, you want to make sure you wash that face cloth. So the first thing you should do when you get home, take it off, go ahead and put it in the washer, and then wash your hands after that as well. And then I mentioned that there is on the CDC website at www.cdc.gov, there are instructions on how to make the cloth face coverings from ordinary household materials. I think even I would be able to do this, and I can't say that I'm super crafty. And please, I know we've talked about trying to reserve surgical masks and N95 masks for our healthcare providers. These are scarce resources right now, and we need to reserve them for our healthcare workers and first responders who have to be, face to face with individuals in close proximity with those who have or likely have COVID-19 multiple times a day. So we really want to preserve those for them. A lot of people have asked about donating such items. If you have them, please donate them to healthcare providers and first responders while you use your cloth masks. The Greater Louisville Medical Society and the Department of Public Health and Wellness are collecting new unopened N95 masks, surgical gowns, protective goggles, gloves, and face shields. So if you have those types of donations, please call the Public Health and Wellness Lab at 502-574-0859, and they can arrange drop-off at our lab at 430 East Green Street during business hours. And again, I just want to emphasize, don't let the cloth face covering give you a false sense of security. Definitely social distancing, staying in our homes and away from others right now is the best thing we can do to prevent getting COVID-19 or spreading it to others. And I know, as the mayor mentioned and Chief James mentioned, it's really difficult with the Easter and Passover holidays coming up, that we want to celebrate with our families and our loved ones, our communities, but please stay at home and do not have in-person gatherings. Use that technology. We're lucky that we live in a world today where we have a lot of technology. So whenever possible, have those virtual gatherings over video or by telephone if you don't have access to video. I've heard a lot of people say that they feel helpless lately because of the nature of this crisis, and it's definitely understandable. Many of us have been cooped up for weeks now, battling something that we've never seen before, and our lives have drastically changed within a matter of weeks. So please understand that you're not helpless, you're not hopeless. Far from it, you can and are helping with every minute that you stay away from others. So your commitment and dedication to comply with these requests to stay at home is by far the most critical element in our response. So thank you, and please know that we realize that this is not easy to continue to do. Everyone, young and old, adults and kids, can support the efforts to save lives. So thank you to those that are doing that. And please, if you aren't, please start doing that. All of us are on the front line of the defense against COVID-19. By staying home, we're avoiding transmission to other people, and you might even be saving one of your own loved one's life or your own. So please continue to stay home. I just want to re-emphasize, I know Dr. Moyer talks about this all the time, but one other very important weapon we can all continue to wield during this COVID-19 pandemic is diligently and dedicating time to that good hand washing. So make sure that you're washing your hands frequently with soap and water for at least 20 seconds after coming in from outside, or any of those essential needs visits out of the home, before you eat, after using the restroom, and after changing a diaper. For everyone, I think you know this already, but just to reemphasize, soap and water are the best. If for some reason you don't have access to soap and water, use that hand sanitizer with at least 60% alcohol. And I think, Mayor Fischer, I think our friends at the Louisville Water Company have come up with something to help us emphasize the hand washing. Is that right?
Very good. Good setup for the water company. So thank you, Dr. Collier. Let's see what the water company is going to share with us here.
Hand washing, germ stopping. Hand washing, germ stopping. Lather your hands from front to back with soap and warm water straight from the tap. Scrub, 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 get disinfected. How long does it take?
20 seconds.
Washing your hands is the thing to do now. Go tell a friend and let me show you how. Hand washing, germ stopping. Hand washing, germ stopping. Hand washing, germ stopping. Yeah, hand washing, germ stopping.
All right. Nice job by the Louisville Water Company that is owned by the citizens of Louisville. So citizens of Louisville, be proud of their little jingle there that they put out there. So yes, everybody just remember, good hand washing etiquette, right? Just like our mamas taught us back in the day. So thank you to the water company. I also want to say We just got some news, it was this week. I want to congratulate the entire Louisville Water Company team, Spencer Bruce, their CEO there. We were just recently proclaimed again as #1 in the United States of America for having the best tap water in the country. So Louisville Pure Tap does an amazing job. It tastes great, and they have a great organization as well. So thanks for adding that little health reminder for us also. So, as we go through this time, I almost end this way every day. It is tough. There's no question about that, and we are all being disrupted. But there is so much good, and there is so much beauty and hope. I think we're all getting to know each other better, ironically, by being distant like we are this way, because we are coming together in a kind of a community collective medium, like these daily briefings or face down over on social media. And we're seeing some beautiful examples of art on our sidewalks and driveways and windows and other spaces throughout our community that just are popping up and bringing smiles to people's lives. And I said, say, keep them coming. They're really a joy to see and a joy to share. And some of these artists should look at that cute gal with her rainbow there. Some of these folks should apply to do a project through the Louisville Arts Network, which we just launched yesterday with the help of Teddy Abrams and our Lift Up Lou program. So you can go to @LiftUpLou or liftuplou.com to learn about that, because every day here going forward, we're going to be commissioning a new piece of art for the community. So it could be music, it could be visual art, it could be dance, and there'll be a small commission with that as well. So that's going to be a lot of fun to see what those are. Now, every night at 7 o'clock, there's an online mindfulness session. Let's see that slide that was just back up there again. And that's what we do through Lift Up Lou. So tonight's session is going to focus on Tai Chi and Qigong. So remember, go to Lift Up Lou. And the Tai Chi and Qigong is going to be brought to us from the new chapter of Tai Chi Chuan and the Qigong Institute. There's some of our really great leaders in the community around Tai Chi. It's a wonderful way to stay flexible, also kind of get your mind in a good spot as well. So they're going to show us how that we can be better together by staying apart, and then also how you can do that by doing your Tai Chi online, right? So practice your Tai Chi moves tonight. Learn how easy it is with them. It's a good, mellow way to stay flexible. So check out that at Lift Up Lou tonight, 7 o'clock, mindfulness every night. And again, our next Facebook town hall is tomorrow morning at 10. And we'll be talking with faith leaders from a variety of different religious traditions on how they and their communities have been responding to COVID-19 and how that's impacted all of them. And then last, just a reminder, everybody, remember we're in the census season, so 2020 census is upon us. Be sure to fill it out online or on phone or via mail. And then go to social media after you do that and challenge your friends. Say, hey, I completed my census. Did you? Census is really critical for the future of our city. It determines how much federal money flows through our city. You can see how important that is right now during this crisis, that we need every dollar we can possibly get to deal with this coronavirus. So please fill out your census forms, okay? All right, good. We've got one question from the media, it looks like, and that is, let's see, now we've got two. The first one's from my friend Chris Otts from DRB. And Chris asked, Mayor, what has the health department done to ensure UPS's compliance with its March 25th order to ensure social distancing at Worldport? And what is my reaction to the apparent COVID-19 death of a healthy 55-year-old UPS Worldport worker? Dr. Cloyer, do you want to talk about the health department practices on follow-up?
Sure. I will kind of go through what the process is when we typically have an individual that tests positive for COVID-19. And just for everyone to understand, when a local county resident tests positive, our health department is notified. So, and then we provide a general notice to an employer. So we don't necessarily name the employee to that individual. As to your specific question, well, as to who an individual is. UPS has not confirmed to us that a WorldPort employee has died of COVID-19. So I know that's been an ongoing question of concern. And then I know others have asked, and kind of what it sounds like you're alluding to in this question, that, in response to 311 calls, the health department has actually visited the WorldPort facility and has been in ongoing conversations with UPS about the steps necessary to ensure the safety of their workers, including sanitation and the social distancing guidance. It looks like we've had about 6 to 7 complaints, presumably from employees, but I don't know that for sure. And we have issued an order to implement social distancing at that facility. So hopefully that answers that question, and then a few others that we have received over the past couple of days.
Yeah, thank you, Doc. And of course, I know we're in regular contact with UPS on making sure their health practices are obviously what they are. They're an essential company in terms of moving commerce around the world right now, so they're trying to balance all of their needs as well. Amina Elahi is asking, Mayor, is the city tracking the racial and ethnic breakdown of confirmed COVID-19 cases and deaths in Louisville? If so, what are the results? And if not, why not? So we're in the process of doing all that. Dr. Claudia, do you want to talk about that at all?
Sure. We do track that data, and I will tell you, because the pandemic, the outbreak, the number of cases that we see every day continue to increase at such a rapid rate, it does take some time, and so there's a lot of unknowns in the cases. So it can take several days before we get all the information that we need about each case in order to enter into our database. So we can share that information. I think we're working on getting some of that information, particularly around the deaths and whether or not we're seeing the same disparities that they're seeing in other places in the city of Louisville. But know that that is imperfect as it comes out. We are trying to fill that information in as quickly as we can, but we may report one thing one day, and a week later we might have entirely different statistics. So I guess just know that as we do report things, that it's not going to be perfect. So I don't think until we get done with all this, we'll actually have an idea of exactly what those numbers will look like.
Yeah, and we'll provide whatever guidance we have here before the week's over as well. I mean, what we're seeing in other communities, obviously, where there's been a lot more death, is that there is a vastly disproportionate impact on low-income communities of color. These communities, as we all know, have disproportionately borne the bad end of health consequences for centuries in our city. That's what our social determinants of health indicate already in America. Before COVID-19, there's a 10 or 12-year life expectancy difference between the affluent and privileged part of town versus the under-resourced part of town. So a virus like this is only going to make that type of generational disparity worse. So, to me, this is a justice issue. It's an issue that we, as a people, have got to ask, is this right? And what are the causes behind this disproportionality and inequity? It's lower incomes. It's worse access to health care, to a good education. We cannot have strong cities. We cannot have a strong country if everybody does not have equitable, equal access to some of these basic human rights that people have. So if there is any silver lining, I hope, that comes out of this COVID-19 crisis, is when we get through it, is for people to look at each other and say, we've got to define our responsibilities differently to each other, and in terms of who has access. Everybody should have access, because what I find is that talent is equally spread, but opportunity and access is not. And that is not consistent with the American dream or who we should be as a people. So when we look at these cities, I know it was last weekend, in Michigan, for instance, is 14% African American, but 40% of the deaths in Michigan were from the African American community. And the virus is infecting all populations at about the same percentage. So that's not the issue. People with underlying poor health conditions are the ones that are struggling the most. So this is something that a lot of work needs to be done on all throughout the United States of America, and I hope we'll get to that after this. So a lot of these underlying problems we've had as a country are really being exacerbated and highlighted by this virus. And it's up to us to do something once all this is said and done with the talk and put the actions in place so everybody can have a fair shot at a bright and hopeful future. Okay, let's see. One other question. How will Louisville make sure churches don't hold drive-in services? Will the police be out patrolling? Okay, so we've seen some churches communicating through their social media that they're going to be having a drive-up service. So first off, we would ask all of our faith leaders, please listen to us. Please don't put your congregants at risk. As Reverend James said, you got to have a congregation to come back to. And you're going to say, well, look, people are going to be spread differently. Here's how it's kind of expanded this week. First, people said, we're just going to do a drive-through. Then people said, well, we're going to give people communion. We're going to walk by and give them communion. And another group said well, then the Easter Bunny's going to come by and give the kids all chocolate. I mean, you can see it's like, no, we can't do this, okay? Because that's how you spread the virus. So first off, if you belong to a church that's doing this, please contact your minister and just say, let's rethink this, okay? Please don't do it. And then also, that's what our 311 line is about. 311 is about reporting businesses you don't think that are complying with social distances or that you don't know is complying with social distancing. And then when you see groups gathering, that's when we need to be reported so we can send somebody by to say, hey, these aren't safe practices. You're putting people at risk. So if we see churches or anybody else doing that, please let us know through 311 and we'll give them a call. All right? All right. Let's see. One follow-up from Amani again as a follow-up to the racial disproportionality or demographic question. How will we be able to access that information? I'll talk about it one day on one of these media briefings, and then we'll put it out in a press release as well. So if you have any questions, I know you know Jean Porter, you can contact her. Jean's the Director of Communications for the City of Louisville. Okay, and that was another question that came in, the same thing. Are we tracking the races of individuals contracting and dying from COVID? We are attempting to have all that information. We're going to be in a position to better report on that later this week. Okay. All right, that's all of our questions. So I just want to thank everybody for joining us today. We're on at 4:00 every day except Saturday, and then we've got our Facebook town halls as well tomorrow's with several leaders of our faith communities at 10 o'clock. So please dial in and learn how our faith community is operating in this world of COVID-19, especially during this holiest of weeks. So everybody, take care of yourself, keep socially distanced, and keep the faith. Thanks for joining us today.